We often believe that shaming messages don't affect us, but from my experience, the effects of a shame based culture or upbringing can be exceedingly harmful. Whether shaming messages are implicit or explicit, they can result in the internalization of negative self messages that lead to feelings of unworthiness, chronic guilt, depression, and anxiety. When left unaddressed, feelings of shame can erode self esteem, hamper healthy sexuality, and lead to addiction. True freedom comes when we learn how to release the immense burden of silent inner shame. Today, we'll focus on this listener's real life question. I grew up in a rigid, highly religious family. Strict rules were the norm. During college, I began to realize that I've been more or less brainwashed by my parents and my environment. I want to become my own person. I'm sick of living in constant shame and being afraid of doing anything to displease others. How can I fix this? And with that question as the focus of today's episode, I'm Dr. Carla Marie Manley, and this is Imperfect Love.
Welcome to Imperfect Love with Dr. Carla Marie Manley, psychologist, author, and relationship expert. I'm here to help unravel mysteries and misconceptions about love, relationships, and mental health issues, plus everything in between. Love is complicated, people are not perfect, and relationships surely can be tough. Together, we'll navigate this messy, imperfect space of real life.
Oh, thank you so much, Carla. I'm so happy to be here with you and to speak to your listeners today.
Thank you. Thank you for your willingness to share your expertise. I know that you're an author of shame oriented books and that this is a big piece of your life's work. But before we launch in to the listener's question and moving into more about what shame is and how it affects us, could you tell our listeners just a little bit about what makes you you?
Sure, absolutely. Well, my career path has taken a kind of a circuitous path as I've followed really where um, pain and suffering has been and where it's kind of led me. And so I started out as a junior high and high school teacher and then was a teacher in a accredited marriage and family therapy program for 28 years and focused a lot on sexuality and on medicine, integrated care, and where we don't address sort of the impact of illness on people. So did a lot of work with physicians and whatnot. But it was through the sexuality course that I taught that, and I was teaching therapists or people who were going to become therapists. This was a required class for licensure that I began to learn from them the impact of shame and sexual shame on their lives. It really turned my career around in many ways because the pain was so palpable as I would read their papers or talk to them or talk to clients during that time. And there was a notable shift that happened in culture right around the year 2000, and where I was seeing an increase in a sense of hatred towards oneself, a sense of thinking of oneself as perverted, as wrong, as bad. And I wasn't really sure at first what I was seeing. So it took a couple of years. But then I realized I was hitting the first wave of, in this case, grad students, first wave of kids, if you will, who hit their adolescence in the mid 90s or so, early to mid 90s, when abstinence only education had already swept the country. We began putting money into that in the early 1980s. And by this point, we had had a tipping point of kids across the United States who had been exposed to this. What we know now is that abstinence only education was 80% medically inaccurate, and it was religious education in hiding. So kids were getting a religious type of education, what Al Vernacchio, who's a sex educator, a well-known sex educator, calls the danger version of sex. Danger, watch out, it's going to kill you, right? And but when you got underneath it, it really had, there was so much religious overtones that were happening. There were also a whole mess of kids that were involved in evangelical churches or other types of conservative churches across that time and since, who continue to get messages, not don't have sex until marriage, but don't think about it, don't desire it, don't want it. If you do, you will ruin your future. You will ruin your chance of getting a particular kind of mate. Um, and for those kids in religious homes, you'll ruin your relationship with God.
Mm.
And so it was deeply felt, and it was taught from, say, because I've latency age kids, 8, 9, 10, 11, 12, before adolescence. And they really because they weren't also given sex education to teach them about their bodies, they were just given this and whatever culture was handing them. It was huge. It was huge on them. So I'd love to talk a little bit about what shame is, what guilt is, but what the difference between maybe just a broad definition of shame is and what sexual shame is, because in many ways, when we get to talking about this listener's question, we're really talking about not just shame, but sexual shame as well, because they were very likely to have been given these messages that were very popular in the 90s to, at least 2010. And I know that there are places that still teach this today in our more conservative states.
Absolutely. And something that, again, we're not anti-religion here. We're not anti any church. So,
No,
well, no, every religion, hey, my religion happens to be love. So let's just, and kindness. So we
yeah,
can just look at this through the lens of any time we are told, as you were saying, if we're taught that a huge part of our being, which is our sexuality, that that is wrong to even think about sex. Oh my goodness. That is a big
right.
message. And it's funny you're bringing up for me this idea of how powerful parental messages are, whether
Mm-hmm.
it's coming from a church or a parent. But I grew up in a very large Catholic household. And I remember I was all of, I don't know, 6 years old. And I had learned about the rapture in catechism. And I would come home. What crime can a 6-year-old commit, right? Especially somebody like me, this little waif of a person, right? I guess it doesn't matter how big you are, but you can still you get the picture. And I would come home, and if there wasn't a lot of activity or I didn't see anyone, I was certain the rapture had come and that I had been left behind. And I was terrified that, and so we can see, especially with this listener's question, that what our brains learn early on, it's not our fault. It's just the messages we get. No one's trying to hurt us. But
Right.
boy, I still remember coming home, and if there weren't people there, it was like, oh God, the rapture came and little me was left behind to fend for myself. So it's a funny story. I bet you can tell
Mhm.
how it worked.
Yeah.
And so for when we look at the listener's question, where this individual, I don't know if the individual, I don't know the gender, but we can definitely see that whether messages are implicit, right? Not
Hmm.
spoken, but they are just there in the environment, or
There.
explicit, very a parental teaching, a
Hmm.
church teaching, a school teaching. It really, especially human brains aren't myelinated until, fully myelinated until you're 25. All of those
Right.
messages coming in aren't, especially at a younger age, they're often accepted at face value.
That's exactly right.
So let's start with thank you for being willing to explore that difference. And many people use shame and guilt and embarrassment. Those
Hmm.
terms are often used somewhat interchangeably, but they're all very different. Do you mind giving us a brief overview?
Sure, absolutely. So guilt is the feeling of I have violated my own ethic. So it requires a child to be old enough to have a sense of their own right and wrong, the beginning of their own sense of right and wrong. So let's say you have a child that believes that it's not right to tell a lie. You know, you get asked, did you leave your toys out and your roller skates out in the middle of the hallway where your sister could trip over them? And you say, no, but you did. And that is actually something, it's a belief that you have that you should tell the truth. Like that's probably a good thing to do. Like, I like it when people tell me the truth, kind of a thing.
Hmm.
Then what they feel is guilt. It's like, oh, that wasn't a very good thing to do. Guilt is actually motivating a change. It motivates us to be like, maybe I want to do that different. Maybe I want to be braver next time and say, I did and I'm sorry. I will do better to pick up my toys, in the future, kind of a thing. It's a learning. It's not a good feeling. We don't like the feeling, but we have violated our own ethic, not somebody else's ethic entirely, but something that we have begun to take on ourselves, or maybe full on adopt by that point, depending on how old we are. Shame is the belief that you are unworthy of love and belonging, period. I'm unworthy. At my core, I'm unworthy. Well, how does somebody come to feel shame? Shame is a feeling we feel when we get in trouble by someone that we respect, someone who's older, who has authority over us, when they get mad at us for doing something that's very natural to us. Like, it's just who we are. What I used to say to my kids, you're fulfilling your job description, right? So you have a 3-year-old who decides, I want to carry the milk from the front porch that gets delivered in glass bottles. I want to carry it myself into the kitchen. So they toddle out, they get it, they carry it, and it slips out of their hands because it's got condensation on it. And it hits a slate floor and just goes, and the parent loses it on them. Now, they're not going to think I shouldn't carry the milk in anymore. What they're going to think is, I must be really bad to have made them so angry. Another really common example that actually kind of gets at what you were just saying, like the messages that we get that are, pre-contemplative, they're maybe even pre-verbal, they're during our childhood, they're before we actually start logging in our memories hardcore. Let's say you've got a 2-year-old, 18-month-old, 3-year-old who has found their genitals. Now, I always say this is a wonderful day, the day they find them, because somewhere around a year old, when they're getting their diapers changed or they're
Mm-hmm.
in the tub, right? Their hands are beginning to become instruments that they can use, that they can, oh, I see that, I can grab it, right? And pull it towards me. So their hand lands on their genitals and they're like, oh, whoa, that feels really good. Because we have all these incredible nerve endings there, right? Now, if they're in a home where they've got people there who are like, yeah, they're going to learn about their body just like they're going to learn about the trees and the skies and the nose and their ears, all of it, then they say, yep, that's your penis. It's a fabulous part of your body. Now let's finish, wiping you off or getting you dry, whatever it is. If it is a home that their parents were shamed by their parents shamed by their parents, religious or not, because this is, I would say 95% of people who grow up in the United States live in homes that are silent or silent in shaming around sexuality, right? And so the child finds their
Agreed.
genitals
Yes.
and they get their hands slapped away. Or somebody says, gross, yuck, they raise their voice. That's yucky, don't touch. Right? And we have to remember, so let me come back to my definition. So in that situation, the child's just doing what is absolutely normal,
Mm-hmm.
natural for them, falls right out of their curiosity of exploration about the world, and they're getting in trouble. And so the inkling of a meaning that happens, and this will happen hundreds and hundreds of times in a home like that, is something must be wrong with me. I've made them this mad. I must be bad. What we have to understand is that between a year and say 5 or 6, like the story you're telling, we often aren't logging memories to talk about later in life. When you ask people, tell me about your first memories of getting in trouble around sexuality, they'll often talk about playing doctor and they're about 5. That's not because that was the first time it happened. It's because it's the first time the brain has begun to log long-term memory, right? Before that, from the time they were a year old and they found it, and then by 2, they were like, this is one of my favorite parts of my body because it is so comforting to touch, right? They're getting in trouble all the time. And so pre-verbal, early verbal, they've been logging, I'm not okay. Something is wrong with me, right? And this will tie into my definition of sexual shame. So not only do I believe that I'm unworthy of love and belonging, I believe I'm bad. I'm bad. And then I'll grow to believe that my body and my sexuality, I'm going to grow to learn that that is bad too. And if you,
Absolutely. And
yeah,
I just want to pause for a minute
sure.
because I imagine our listeners might be able to go back in time and think of some point because little ones, they're touching their genitals, they're not realizing it at first and how comforting it is. But when you see a sonogram, often
Yeah,
the little fetus has its hands, on its genitals. It's just normal. It's part of the body. And so I think for our listeners, for all of us, we might be able to go back into our memories and think, oh my God, I remember that first time when I was shushed, or I was told something I did was dirty, or mommy immediately, put blankets on me or told me no, or something. I was shamed. And that sense, as you were saying, that sense of shame goes very, very deep, because the child's brain isn't developed enough to know that,
yeah,
oh, it's this one action that might not be appropriate in this setting, because the child's not thinking that way. The child is thinking, I, as an entire human being, am
right.
a bad little being. And that
Yeah.
is a big self belief to have implanted at an early age.
At an early age, exactly at like a pre-verbal age. And then it just
Yes.
gets reinforced over and over. And so let me share with you and your listeners the operational definition of sexual shame. And we did not have this. We didn't even have research on sexual shame until 2017. So only about 7 years ago. And I was so grateful for this student, this PhD student, for doing this work, because it became foundational to work for us to build on in really understanding the impact of this on our ability to do attachment well, to do love well, to give and receive love well, which I'm always saying, that's one of the most important qualities of a life, is how well you give and receive love. I worked in oncology for a decade, and that's what cancer patients taught me, that they didn't want to talk about what kind of work they did very much. They didn't want to talk about what they had accumulated. They wanted to talk about the people in their lives and how well they loved, or what they wish they had done better with regard to love. So it has so much to do with attachment, love attachment. That's what offers meaning to our lives. And I think it's pretty universal that when life looks like it's going to be threatened, and we boil down to what's most important, it comes down to our relationships and how healthy those feel, how loving and meaningful and nurturing and nourishing those are, or how much they hurt because of the pain and strife that might be between us and someone else.
So
So,
let's
in this,
pause for a minute.
sure.
You used a term that I want our listeners who may not be familiar with it to understand, and attachment research, attachment science. My most recent book, The Joy of Imperfect Love, is attachment based. Yet some people might not know what you mean when we're talking attachment. So
Mhm.
let's pause for a minute to talk. Let's talk about attachment and how this relates to shame. Who would think, right?
Right.
So
Yeah, I guess.
please.
Well, when we think about just the general definition of shame, feeling unworthy of love and belonging, which was Brene Brown's, I think, initial definition of shame. If I don't believe I'm worthy, if I don't believe that I have value or that I'm good, I'm going to begin to put a mask on, and I'm going to be the person I think you want me to be, or culture wants me to be. And then when somebody loves me, I will think to myself, they're not really loving me. They're loving this mask I put on, because I'm not, if they really knew who I was, they couldn't possibly love me. So, attachment is our ability to believe we're lovable, receive someone's love, and then give love to a safe, loving other, and have a reciprocity, a relationship of loving and caring that goes back and forth between us and other. We learn this at the very beginning of life with whoever is loving us and caring for us, and how well they're able to do that. That is going to set the foundation for us of how we're going to do love and attachment later. So, for example, if a child is left crying way more often than not, they're going to think, on some level, they're going to think, this world isn't safe for me.
Mhm.
right? And I have to be very careful. I'm going to have to figure out how to be strong myself, self-soothe myself, right? But a fundamental belief that the world is not safe is going to interrupt your ability to do attachment,
Thank
right?
you for that clarification. And for our listeners, Dr. Tina is illuminating the difference between secure attachment, where the parent is
Mhm.
a good enough parent per Winnicott's,
Right,
terminology,
exactly.
the good enough parent who's not perfect. No parent's ever going to be perfect, but they're there and attuned in a non-shaming way most of the time. And
Right,
then the other segment is the insecure attachment, and there are three types of that, but those children, as you're saying, do not feel that that love is present, that love is unconditional, and that they are worthy of being loved,
right,
and
right.
therefore struggle through with many issues throughout life, but often very much in intimate relationships. So let's go back to,
Yeah.
thank you for taking the
Mhm.
pause to clarify that. So let's continue on with shame.
Yeah, yeah. So the definition of sexual shame is a visceral feeling of humiliation and disgust toward one's own body and identity. So, who you are, identity as a sexual being, and a belief of being abnormal, inferior, and unworthy. This feeling can be internalized. In fact, it starts out well, let me go on. So this feeling can be internalized, but it also manifests in interpersonal relationships. So that's really where it starts with the infant or the young child and an other, right? But then it slowly moves internal
Mhm.
also, right? Having a negative impact on trust, communication, and physical and emotional intimacy. So I always say that you are hurting. I can't imagine hurting anyone more than hurting them here at this very place where they trust, where they communicate, where they love with their body, where they love with their heart, right? If you're going to hurt them there, then you're going to hurt them at a core place of sort of thriving and happiness, right? Sexual intimacy develops across the lifespan, as I've explained, in interactions with interpersonal relationships, so the child and another or many others. One's culture and society then begins to play into it and creates a subsequent critical self appraisal. So, an inner critic that is a feedback loop that
Mm,
just goes on and on, right? So, we live in a culture where we know 50% of 6 year olds are already modifying their diet because they don't believe they're good enough. Two-thirds of 9 year olds, 90% of 15-year-old girls,
oh my
right?
goodness.
So this is deep. They're not good enough. And they're bringing it in from culture. They're bringing it in from their interpersonal and attached relationships. And then that gets an inner critic going. So before you're 15, probably you've got something that's always telling you you're not a good enough. You're not good enough. You're not pretty enough. You're not this. You're not that. Things like social media and all of those different platforms haven't helped this very
Not
much.
at
You have
all. Not
no,
at all.
especially for our adolescents, I think.
So I have a question for you, because, and then I want to dive back to the listener's question. There is often a sense that hypersexuality, or the people who are out there, and I believe in healthy sexual behaviors, whatever form those take for somebody, whatever somebody really
Mhm.
wants to do and feels good about. But I've noticed a pattern with my own clients, that and my group work, that sometimes those who are sort of mindlessly hypersexual, thinking more is better, if that's actually someone who's unconsciously acting out against the shame. They don't realize, they think that, and so some people really retract from sex and say, I'm just not going to do it because it's bad. They've been given that message. Whereas other people go the other direction and think, I'm going to just, and they're not thinking about it, but I'm going to have so much sex. I'm going to act out. I don't care who I hurt in the process, what I do. I'm just going to have so much sex to prove that I can do it. That prove. What do you think about that relationship to shame?
Well, I think that often people are trying to fill a void inside of them. So the void that sexual shame creates and shame creates is that I'm not possibly good enough. But if I go find enough people to have sex with or whatever, I can try to, and I'm going to get a good dopamine download, right? I can convince myself in that moment.
Mm,
The problem is that 10 moments later, a day later, whatever, I'm back to feeling that emptiness, that not good enough again. So I've got to go do it some more. It's the only thing I know to take some of this inner pain away, right? And I just think it's a drug, it's their particular drug of
it's their
choice.
particular addiction
Mm-hmm.
at that particular time.
Yeah, I don't even use the word addiction. I mean, I use the word out of control.
Mm,
If a person feels like they have out of control sexual behavior, or it feels like it's interrupting, their life in some way, then we want to look at that. We want to look at, well, let's see what's going on here for you, what might be driving that kind of thing. But I don't tend to use the word addiction. I know it's a popular word to use, but being a clinical sexologist and somebody who's certified as a sex therapist, we know that there's not adequate research to use the addiction terminology or model on it. And that's why it's not in our DSM books, it's not in our diagnostic books.
no, it's not. I'm more talking about the addictive nature of the
Yes,
behavior
right.
because we see that shame, and
Mm-hmm.
there's a preponderance of
Yeah.
research on the connection between shame and addictive behaviors as a whole.
Yes. Yeah.
So, yeah,
And I
that's
think
where.
that's really worth talking about because we live in a culture that can really support somebody being a workaholic, but that could very much be the same thing that's going on. They're just continuing to try to get the accolades to show themselves that they are fine, that they're important enough, that they're whatever, but it keeps not working. Underneath, they're still angry. Underneath, there's still shame. Underneath, there's still, an unhappiness there.
Absolutely. And talking about our diagnostic manual, the DSM, it's not in there because
Right.
working too much is considered positive, but it
Right.
is in that it can be in that
Yes.
addictive category. So
Mm-hmm.
let's take, thank you for that. Let's take it back to the listener's question
Mm-hmm.
for a moment, where
Mm-hmm.
this individual is struggling with how to, it sounds like there's so much hope and willingness here. Like, I realize I've been
Yeah,
exposed
absolutely.
to non-shaming, elements in this college life, maybe post-college life, and I want to set myself free. What would you say for someone who's, it feels almost like they're on this precipice, like wanting just to fly out of this nest and experience more? What might you say for
Yeah. Well, first, I just would want to wrap them in some kind of a word hug or something because they are so not alone. We're at a tipping point, whereas as much as 20% of the US population are people who are coming out of conservative uh, religious frameworks that taught them that they weren't good enough, even though the core belief in their faith may have been you are unconditionally loved just as you are. You've always been loved since the moment you were conceived. You were loved. You were, cared for. You were whatever. But that's not what they experienced. They experienced a lot of fear, and in that they must be not good enough. So first, I want them to know that they're not alone. In the first book that I wrote, Sex, God, and the Conservative Church, I take somebody through the arc of how America became sex negative, the role that conservative church played in shaping the way that we do our culture. And so our consumer based culture has been very much tied into a lot of religious stuff and just sort of shape. I want you to know what the history is, that it's not you. It's not you. It probably wasn't even your parents. They probably loved you and were doing the best they knew how. They just didn't want to mess up because they kept hearing that if they didn't do it right, that they were going to mess you up. And so they were giving you what they were told they should give you. And yet you've come to find out that it actually was really hurtful. You're not alone. And I would say there are so many books out there now and podcasts of people that are having this very same conversation. Um, but in the book that I wrote, I sort of shape how did we get here? Were we meant to be sex negative, or was there ever anything written in like Abrahamic scripture that was sex positive? And there's all these beautiful stories that I had never heard until I went looking for them. And so I share them with people in the book saying, sweetheart, you were created amazing and wonderful and desiring of connection and pleasure, however you choose to share that in a consensual way. You were born desiring of connection. It's human connection and of sharing pleasure and joy with others. And that is who you are at your core. And so these stories that are ancient show that that actually was very much talked about in early history. And then I go into how do you heal? So, how do you heal? And that's, I think, some of what this listener is asking about. So I talk about in the book what I call the model for healing the mess, the model for erasing sexual shame, the mess. And in that, there are 4 different sort of tasks that you do over and over and over again. And it's like peeling an onion or allowing the shame to just start to fall off of you, drip off of you. And so it's frame, name, claim, and aim. Frame is get yourself a frame or a scaffolding of sex education. Learn what you were never taught about how magnificent and amazing truly your body is in all of its ways. And there's many good books that are out there. I give some suggestions in there, and I do on some of the information. I'll give it towards the end of the podcast. But get that sex education. The second book I wrote for parents around how to raise shame-free kids. But what I have learned from so many people who've picked it up, who maybe have children in their life as nieces or nephews or whatever, is that they got the sex education they wish they had gotten by just following that book, doing
Ah,
birth to 2, 2 to 4, 4 to 6, reading the kiddo books that are in there, asking themselves the questions that I ask the parents, which are like, what do you imagine would have been different for you if you had somebody reading this book to you when you were
mm,
little? And as they walk themselves through their whole timeline, they're like, oh, that's what I was supposed to get. I get it now. And it helps, again, the shame to just strip off. So that's frame. Name is still tell your story to somebody, right? Like this listener is so bravely doing with us, telling us a little about their story. If you can find a therapist, you can find some friends, you can do a book group, with a book or my book or any of the great books that are out there, and then just talk along the way about how it was different for you or how it was similar to you, because you're going to find out you're not alone. Like I said, I would say 95% of people who grow up in America grow up in homes that are silent or silent and shaming, and that's why we have so much ignorance,
of
because
course.
people got their information from media and friends who got it from media, but very few people got the actual information. So that's name. Claim is claim your body is good. Your body is so good. How we're shaped, like you called yourself a waif, how we're shaped is so much more about our heredity than it has to do with anything else. I'm a Swede. I am built like all my Swedish relatives, pretty much. I'm like, I can survive. I always say I'm built so I can survive a famine. You know, it's just how we are. We are. But being 20 to 40 pounds overweight has been my story my whole life. And that's just true. That's just how my body is. It's healthy, and I'm grateful for that. But we live in a culture that we're compared to airbrushed images that aren't even true.
Mm,
And the amount of people whose heredity has them very, very tall and very, very thin and looking a particular way, that also is very rare, right? It's, whatever it is, probably 5%, 6% of the population is naturally that way, right? So, we have to do a lot of work around that, because like I had said earlier about how much information we get about not being good enough, because if we believe we're not good enough, we're going to buy more things. That's how our economy is driven.
absolutely. That if you don't look like whatever that 5% factor is, you've got to do whatever it takes.
Hmm.
including for men. I've heard of, shin implants, or for women, do this, and not shaming anyone who elects to have surgery. If you elect to have
Yeah,
some
right,
surgery so that you feel better, absolutely. But we can see where it's coming from, this
right,
arbitrary,
right,
and it shifts depending upon where we are in history. Marilyn Monroe was
right.
considered the ideal at one point. Twiggy was the ideal in another point.
That's right.
Now it's some, who knows what it is today, 'cause I don't pay attention.
Yeah, I know.
Anyway,
Yeah, I'm with you. And but it's important for people to be like, okay, if I got to get up this morning and I was not in horrific pain, it's I have a good body and I don't want to get to my deathbed and wish I appreciated it more. I want to learn to appreciate it now. And again, I give recommendations for good books to read or people to follow and just learning to embrace your body as good. So we've got frame, name, and claim. When we work those three things, frame, name, and claim, over and over again, what we begin to do is we aim for a brand new sexual legacy for ourselves, for our anybody we're in close community with, for our children. We start to see bodies, connection and pleasure, relationships, trust, safety. We see these things as good and giving us a lot. And so doing that work will help to slow the shame. And I would say just keep, following, people on Instagram and podcasts of people that are talking to people about this because you're just so not alone.
so
Yeah.
let me pause and just reflect some of this back to you so you can tell
Yeah.
me if I got it right. And when you say, before I even get into that, when you say hop onto Instagram, I'm not a big social media person, and somebody else even handles my Instagram. That's how much you know, I'm a little reserved
Sure.
with it. But there is one that pops up when I go into, because I try and check on it to see how it's looking or whatever. And there's this one that pops up with this very body positive woman. I don't know, by today's standard, she's maybe, I don't know, 40 pounds overweight. I don't know. She is so full of joy. She is
Yeah.
so beautiful. Her message is all about trying on these different clothes and letting you see how these clothes that are meant for, a 6 foot tall, 100-pound model, how they look on her body. And she's so joyful about it and so genuine about it. And so when you're saying pop onto Instagram or social media, find channels, like find accounts like that make you smile, not that make you turn away and go, oh my God, I'm ashamed of my body. This woman obviously has done some work to love her body, and she
Yes.
exudes this love. But I also remember she happened to pop up right around New Year's, something about she ate too much cheese or this or that and couldn't fit into her jeans. So she's very real. And so anyway, I don't know the name of the account, but it's, let's fill, if we're going to
Yes.
use social media,
Yes.
let's fill that time with ones that make us feel good, that make us smile, not that make us feel ashamed or insufficient or imperfect or not enough. Let's just celebrate that we are all imperfect. Even those 6 foot models are imperfect because
Oh,
they're
yeah.
airbrushed too. So let me go back to the piece just to make sure I have the frame, name, and claim right for our listeners. So the framing, and we'll take this back to our listeners' question. For her, you're saying, go back and get some wholesome, non shaming education about
Yes.
your body. Start with that very core piece of who you are, because that's what we have when we come into the world. That's where we're learning. So you're saying, get a nice framework here so that you
Yes.
look at your body, you're in your body, and you're loving your body, and you know about your body. So that's the frame. Then you're saying name. Tell your story. And
Hmm.
kudos, listener. Kudos to those of you who are listening where this resonates. Start telling your story. Maybe
Hmm.
if you don't feel safe at first, maybe you can just journal about it. Maybe
Hmm.
you can start a book club where maybe some of the themes are around healthy sexuality or unhealthy sexuality so that those become talking points. But get used to telling your story, even if it's to a best friend or a partner, someone who can understand, because you're so right that this naming, this telling the story, when we start understanding how early in life these shaming messages. And we invited listeners earlier to pop into their past. No shame, no blame, no judgment, but just think. And as I was doing that, I was thinking, oh, I remember this message. Oh, I remember playing house and this happening. Oh, I remembered this happening. Oh, okay. So we can see that there aren't a lot. Parents
Right.
don't generally mean harm. They just want to keep you safe. And sometimes they do want to cause children harms, but that's a different side of the issue
Yeah.
altogether. And then the last piece, the claim, is you're really asking people to claim their bodies in an unapologetic way of saying,
Hmm.
wait, this is how I show up in the world. This is
Hmm.
my body. I want my body to be healthy and strong. And this house that I live in is good and solid. And through that process of repeating those three pieces, the frame, the name, and claim, that some of that programming that's happened over decades. If let's pretend this
Oh,
individual who
yes,
wrote in
absolutely.
is 30, it's been 30 years of, they use the word brainwashing, 30
Hmm.
years of brainwashing, 30 years of programming. If you've been on the
Hmm.
planet 20 years, 50 years, that's how long this is, 80 years. That's how long this has been in your body. And body, mind, and spirit are all interconnected. Okay.
Absolutely.
Wow, this is a lot. So, Dr. Tina, do you have any other tips for our listeners today?
Yeah, if this person or anybody who's resonating with your listeners question goes, well, where do I start? Just like give me one thing to do. Can I just start with one thing? Like, as it feels big and overwhelming. I would say get the book Shameless Parenting, Everything You Need to Raise Shame-Free Confident Kids and Heal Yourself Too. It reads like a workbook. It's got 150 pictures in it. It is not overwhelming. It's very bite-sized. Start at the beginning, birth to two, and read about, because I talk about here's what kids typically are trying to accomplish emotionally and behaviorally during these 2 years. Here's if they have curiosities about the body or about others, whatever, they're going to tend to manifest them in these ways, right? So it's very kind of just says, here's what's common in this 2 years. And then I give a bunch of questions for reflecting. And then I say, here are the top like 3 to 5 books for this age person and for parents. And I would say go to the library, do one section at a time. It'll feel it'll feel gentle to you, but it because it'll start with you so young you don't even remember. And you'll begin to feel inside like a hope and a liberation beginning like, oh, okay. This area of human sexuality is the only area I can think of where we purposefully raise our children and tell them nothing about it. Imagine doing this with driving a car, saying, yes, you're going to drive a car when you're 16, but we don't talk about it. Nothing at
Oh
all.
my
Not at
goodness.
all. We don't do any because it's bad. If we
Oh,
do, you're going to go take that car. As a 4-year-old, you're going to take that car. So we don't talk about it. As an 8-year-old, you'll take that car. We're not going to talk about it. Like, imagine that we did this. And then at 16, we handed them keys to a car, to a plane, to anything. We do this in around interpersonal relationships, around sexuality. We have to understand that comprehensive sex education is not just about sex. We teach kids about relational intelligence, emotional intelligence, social intelligence. And then we start teaching them about the body and puberty and whatnot as they grow up. And then we give more and more consent. But we start with body autonomy. Where does your body begin? Where does it end? Where does that person's? Do we get to do to them anything we want? They get to do to us? I mean, we're teaching about relational intelligence, right? Social intelligence. We don't do this. And it's the most important, probably significant area of human happiness is how we do our relational lives, right? So to me, it's like we really need to wake up and especially with all that kids are getting, the marriage of violence and sexuality is so a part of our media. And
Oh,
kids aren't,
terribly.
not shielded from that, but then they don't have positive views to look at.
I agree with you. There is so much that is out there in the media, movies, television, all over the place that makes sexuality bad on one hand, really great on the other hand, and then they marry it, as you're saying, sex and violence, sex and anger, rather than focusing on this truly relational aspect of
Hmm.
sexuality as part of showing love, of being
Hmm.
loved, of giving love, and loving your own body. So I absolutely appreciate everything you said. And I just want to wind it up with emphasizing the piece you said, although this may sound to a listener like, wow, this really took a turn into sexuality. I'm really getting from you on a very deep level, especially with you likening it to driving a car. We
Hmm.
want to be educated in a relational sense, and
Yes.
healthy education around sexuality, that's just one part of being educated about how to relate to other human beings in kind, respectful, loving, boundaried ways. And when you have that as a foundation, then we would never use sex
Hmm.
as a way to harm somebody or to
Right.
keep someone from their own body and their own healthy loving relationships, whatever that looks like to them. So if you're bringing it to this individual and saying, wait, let's just start from loving your own body. Let's
Hmm.
go back in time and start. And I love the idea of, I know you have two books out and they'll both be in the show notes, but the one that you mentioned, I'll mention it again, is the one on shameless parenting and everything you need to raise shame free, confident kids and heal your shame too. And that's so important because sometimes, as we're educating our children or, somebody we're caring for, we heal ourselves in the process without even realizing we're healing because we're learning and we're developing into more whole human beings and
Hmm.
releasing some of that programming that has been so negative. So,
Right.
thank you, Dr. Tina, for joining us today. It has been such a joy, such a privilege. And where can our listeners find you?
So you can find me on Instagram at Dr. Tina Shameless. So DRTINA Shameless. You can also find my website, which is tinaschermersellers.com. And I have all kinds of resources on both of those platforms, things that you can download for free, all kinds of things. People are always welcome to DM me if they have a question about something. Happy to point you in a direction of how to get more resources. Yeah, and then you can get either one of my books on Amazon or other booksellers. If you have a favorite bookseller and they don't have the book, just go up and say, please order this for me, and they'll get it for you. Yeah. And then, yeah, that's probably good. I mean, I'm involved in lots of other things too, but that's probably a good place to start. And if anybody has any other questions, I'm happy to point them in other directions.
Thank you so much. It has been such a pleasure. And thanks to our listeners. And this is Imperfect Love.
Thanks so much for sharing your time with me today. Remember, you have the power to transform your life and love fearlessly, if imperfectly, and it's my privilege to help you along the way. You can find more life-changing content, including my books and other podcast episodes, at drcarlamanley.com. Feel free to submit your own confidential questions through my website. I'll do my very best to include your issue on a future episode. If you found this podcast helpful, please subscribe and leave a review. Until we connect again, this is Dr. Carla Marie Manley wishing you oceans of blessings and love. Please note, this podcast is psychoeducational in nature and is not intended to replace formal mental health support. Please contact your healthcare provider or emergency hotline if you need psychiatric care. And as always, please take good care of your amazing, wonderful self.